Well, I'm a radiation oncologist, and I trained in a sort of subspecialty of radiation oncology, which is called brachytherapy, in which instead of aiming a beam of radiation at a patient to treat him or her, you put a radioactive source within the body. And that's done through a surgical procedure, and that's what I do. Most of my practice is prostate cancer. Prostate cancer nowadays is diagnosed typically by a screening test. In other words, no symptoms. Patients are almost blindsided sometimes by this diagnosis because they have no urinary symptoms, no other things they consider to be cancer symptoms. Almost the first thing I say to a patient, I can say this accurately, is that you were diagnosed with one of the cancer is very, very curable. And really, when we're discussing how to deal with your cancer, you need to focus less on the cure rate, which is extremely high no matter what you do, and more on the quality of life you'll experience afterwards. I believe we should probably diagnose almost everybody. We need not treat everybody. And right now there are an awful lot of research trials and algorithms that are in place to help manage people who have been newly diagnosed with cancer that seems to be relatively very low risk, and we can probably put them into a setting in which they get frequent follow-ups. And as we follow them, if ever the cancer shows sign of progressing, then we pull the trigger. So it's called active surveillance, and we've been doing this for, good Lord, maybe 10 years plus. I guess from a standpoint of sports, hobbies, etc., I do like to golf. As it turns out, I live in an apartment, so my contact with the green part of the world is not there. I can't walk out into a backyard and smell the roses, literally. So golf is my fix for that. I'm not very good at it, but I still enjoy it.